Let's talk to Dr. Clare Craig, who's a consultant pathologist and joins us now. Good morning to you, Clare.
Good morning,
Good
Julia.
morning to you. We know that we the taxpayers have already spent billions upon billions on mass testing.
The key thing is, what are you trying to achieve with testing? So the point that I think we all understand is that you're trying to stop the spread. And there is absolutely a scenario where people will have caught the disease, and there's in a period when you don't yet have symptoms of a day, maybe 2 days, and then you develop symptoms. But people have sort of missed the point about what we do around that. And there are two big points of confusion, I think. One is, what contribution to outbreaks do those people in that pre-symptomatic period make? And it hasn't been looked into very much, but it has been looked into in Singapore. And in Singapore, the estimate was that 7% of infections were caused by pre-symptomatic spread. So it's a proportion, but it's not a massive proportion. And where we've all got very, very confused is with this idea of asymptomatic spread. So there's a belief that people who've have COVID and never have a symptom can spread it. And that belief is not founded on good evidence. It's founded on incredibly weak evidence that has been recycled by people doing reviews of the literature, because a story in medicine doesn't carry much weight. You want a group of stories. So they group the stories together and they say, oh, we've looked into this and it's this percentage. When you actually look at the stories behind those percentages, there are six people who are said to have transmitted it asymptomatically.
Who then didn't go on to develop symptoms. So the key thing there is, a couple of days before you actually get symptoms, you may well be able to spread it. But if you don't ever get symptoms, you're saying the evidence that you've seen does not suggest that they are certainly on any grand scale, or indeed much scale at all, able to spread the virus.
Not at all. And so that those 6 people, let me tell you about them, because even those 6 are really questionable. So there's one guy from China in Guangzhou, when they were testing like crazy and had people in quarantine. They were testing thousands of people. And they found a man in his 30s who never developed symptoms, who tested positive. And he happened to work with another person who also tested positive and never got symptoms. And that association was described as asymptomatic spread. Nobody had symptoms.
Okay.
And that story seems to have been replicated in the literature. There's 2 of the 6 were in Vaud in Italy, and it's the same scenario. The people they were said to have spread it to also never had symptoms.
And this is the thing about people getting symptoms, because we've seen the goalposts moving in terms of coming out of lockdown, from people dying to people needing, healthcare in the ICU, mechanical ventilation, a big strain on the health service there, people needing to be admitted to hospital at all for any treatment, down to people having long-term COVID symptoms, long COVID, or down to people just having cases, just simply people testing positive, whether they've got more than a mild cough or anything at all. And this is the issue, isn't it? Is the moving of the goalpost to actually finding anyone who's got this virus, even with the rollout of the vaccine to the most vulnerable people most likely to get seriously ill or to die. It does seem rather questionable to some of us who would say, well, I mean, what difference does it make if lots and lots of people are spreading a virus that just gives people a bad cough? I mean, the vast majority have no chance of dying. I mean, we're talking about a 99+% rate of people having no long-term problems whatsoever. Should we even be concerned about that?
Or you can actually look at it the other way around. So the other way around, you say, well, hang on a minute. If we're going to get an immune population, we need to put the people who are healthiest and strongest at the front. They need to be the ones mixing and making sure that as a population we are safe. By hiding everybody, we're treating everybody as equal to the vulnerable, and that makes everybody at the front. It puts the vulnerable at the same position as the healthy and the strong.
And actually younger people getting the virus, younger healthy people, not people who've got serious health problems, obviously, that they are actually, again, we know statistically how few of those people will have any serious issues at all with COVID, let alone die. They actually can help by being out and about and getting infected. Can they actually help the more vulnerable people to stay safe?
That's exactly my point. Yes, they can. Although I would add that at the moment, the lateral flow test positivity is essentially the false positive rate for lateral flow tests. So at the moment, they cannot find in the asymptomatic population that they're testing anybody who's got pre-symptomatic disease. So we're back where we were in May. Do you remember I once told you about that study James Barnacle did in May in Imperial, where 80% of his patients a month after peak deaths they had a label of COVID, but they didn't actually have COVID for that admission. And only about 2, maybe 3% had acute COVID. The rest had complications of COVID. That's where we are. We're a month after peak deaths, and we're back in that situation.
Okay. It's going to be fascinating to watch this roll out, because I do worry that the thing that the government and many people think is going to be the route out with the mass testing is actually the route to stay back in. Just finally, I do want to say we've not spoken to you on the show for a while, Claire, and I know you've been doing other shows. I want to say a big thank you to you, because you're one of the people who's been brave enough to speak out on this issue and to put your professional skills and your reputation on the line. And I know that you have taken the most horrific abuse on social media, and you've been one of the people who's been named and apparently shamed on this despicable website that's listing so-called COVID and lockdown deniers, and like these ridiculous, horrible phrases that have been used by someone, an MP, by the way, on the government payroll, which I think is absolutely shocking. Drawing up lists of academics who don't agree with government policy is something that, frankly, any government should be ashamed of doing. But we know that there are so many scientists and medics and people who want to speak out but are afraid to speak out, but you're one of the people who has, and I for one am incredibly grateful for your bravery, your courage in speaking out. You and I, everybody, sage scientists, we don't all get everything right, but you come from a good place and you're doing this for good reasons, and you are trying to help bring some sense and reason and morality to the debate, which I think has not been there. And I for one am incredibly grateful to you, and I am so sorry that you have had to take the abuse that you've had to take.
Thank you, Julia. It's really wonderful to hear that, actually. I know it has been difficult at times.
Yeah, I mean, I've got the skin of a rhino, and I get it every day, but I've had it for years over Brexit, so it's just water off a duck's back for me. But I know it's very, very difficult for people who went to the eye of the storm like that. So, all credit to you, and thank you.